Hi everyone, I am Jillian Kentish. I am a biology pre-medical major from Queens, New York, and I'm going to be talking about the cancer and health disparities in my city where I stay now, Atlanta, Georgia. As I previously stated before, um, cancer and health disparities can affect um, pretty much anyone who resides in economically underserved communities. Um, for example, in Atlanta, African Americans make up over just half of the city's residents, but a recent study has found that 80% of black children here live in neighborhoods with high concentrations of poverty, which often, unfortunately, have poor access to quality medical care, while only 6% of white children do. So several of the neighborhoods with predominantly minority communities have poverty rates higher than 40%. Um, I personally think in my city we should be way further along than that. Um, the Surgeon General, Dr. David Satcher, which is the former Surgeon General at the Institute of Morehouse School of Medicine, also agrees that there should be an access of care in all backgrounds, in all communities, not just um, the economically represented or the high socioeconomic communities, but also in the low. And I think when we create that equality in our communities, we can decrease the amount of disparity that we see. We can decrease the amount of mortality and morbidity that we see. On average, black men are dying and being diagnosed every day with prostate cancer. The reasons for that can be due to a number of different factors. Stress, diet, background, environment can play a complete role in how cancer can survive and proliferate in your body. Um, and so that the health gaps between African Americans and whites in Atlanta and other cities aren't just because of shortcomings of the healthcare system alone, but from people who've spent the time studying that issue. It can be a constellation of things. I also think it starts with preventative care. Once we can get these communities that are already underserved in a lot of different ways into uh, primary care facilities, diagnosing them early if they are diagnosed with anything at all, getting their diet on track, providing them with assistance with groceries, providing them with assistance of better access to healthier groceries. Um, it is very clear that we can lower the amount of not only cancer health disparity, but disparity in the community entirely. Um, and once we can use preventative care, we can start a really big umbrella of getting the communities back on track.